I am Dr. Mustafa Hasan, popularly known as Dr. Hasan. I am DCH, MD and MRCP in pediatrics from London, and I've been working in pediatrics for the last more than 25 years. I was outside India for about 22 years, and now for the last 4 years I'm in Delhi working in Dwarka in Bensups Hospital. A very common complaint is persistent cough. The child, after an episode of fever and cold, running nose, after 4 or 5 days of cold, he improves, but he keeps coughing for a prolonged period of time, 10 days, 15 days, and the cough doesn't improve. Off and on he will vomit with cough. This is a very common problem here, and if the child has already had 4 or 5 days of cough, the virus has left his body. But if his symptoms of cold are still persisting, that means he has developed allergy to the virus. Now here, this child will keep coughing, and especially when he lies down, the nasal secretions, they come to the throat, irritate the throat, and he keeps coughing. In this situation, the child only needs some anti-allergic and he stops coughing. But the same child can also have some phlegm in the chest associated with wheezing. So in any child who comes with this type of symptoms, the child's ears also should be examined, because even persistence of fluid in the ears can be a reason for persistent cough. It could be a case of asthma, or it could be a case of nasal allergy. All these things we examine, and the treatment has to be individualized. I have seen that people are giving bronchodilators and antihistamines and mucolytics all together. Actually, all these medicines, if given together, they nullify the effect of one another. The child should be given minimum medicines, and most often antibiotics should be avoided, which actually compound the problem in these things. If there is no definite indication of antibiotics, no infection or pus coming from the sinuses in terms of in form of posterior nasal drip, then there is no role of antibiotics. They should be managed without antibiotic, and this is the way they do very well. And there are a lot of whims here, that the child should not be given banana, it should not be given curd and all these things during cough and all. These are all misbeliefs, and the child has a limited appetite during acute episode of wheezing and all, and if he whatever he wants to eat, you don't give him, he doesn't get anything in his stomach except in medicine. So how will he improve? Thank you very much for the patient hearing.